need fairly draconian measures for the next few months, then we're going to have to be very careful over the next winter. And as you say, hopefully get a vaccine next year. But life is not going to be normal until we get a vaccine. I think we can basically fairly safely say that. So what I see is quite a big lockdown for the next few months, gradual lifting of the lockdown, hoping that we don't get a resurgence. But if we do get a resurgence in cases, then the only way to suppress that will be to renew lockdown and social isolation measures.
How dangerous is next winter? Because how dangerous is a flu season where things get cold and people naturally over-transmit these things that are more susceptible, and I guess the R0 goes up?
Yeah. Well, the seasonality of this virus is not clear. And the fact that the virus has spread quite a lot in hotter countries like Thailand and Singapore, for example, indicates that there may not be a big seasonality factor. There's quite a few factors in why things are seasonal. One is behavioural, that people tend to shut the windows in their offices and all huddle together to keep warm. So there's that behavioural kind of aspect of it. Another possibility is in winter people don't expose themselves to the sun, so the vitamin D levels in the blood go down. That's one of my personal, I think there's evidence for that personally. And another is that you get a cold, runny nose, and that can let infection into your nose more readily. So there's quite a few factors. But what is particularly concerning, if this virus is still around in substantial numbers next flu season, is that if you get the COVID-19 virus and the influenza virus at the same time, that is probably a particularly bad combination. You really don't want two viruses at the same time. So what I would expect is that we do carry on seeing at least some cases right up until the fact that we get vaccine, because herd immunity is only going to develop when something like 50, 60, 70 or more % of the population get it. And without interventions, it could well be that 80% of the population globally are exposed to COVID-19. Wow. And when the vaccine comes, it's going to need to be a global effort as well. One of the things I've been terrified, Brian, about in this epidemic is places like India, Bangladesh, Pakistan, Nigeria, where there's a lot of people living in relatively basic accommodation, often very close together. And, the potential for spread there is, once there's community spread there, it's virtually guaranteed. There's going to be an awful lot of spread, and if 12% of those people get ill all at the same time, well, a lot of these people don't have access to healthcare at the best of times, or very poor quality healthcare at the best of times, and basically they're not going to get it, and that means the case fatality rate is going to go up. And at the moment, that could well be 3-4%. All the people that get critical in an advanced society who can be managed in a poor society aren't going to get effectively managed, and the case fatality rate is going to go up. So it's really quite frightening what could potentially happen in poorer parts of the world. It's bad enough now. We're suffering enough now in the UK and the States. So I'm just hoping this lockdown in China, in India, for example, is going to be effective.
Is it too late?
No, it isn't. That's the problem.
Right. Do you think it's too late for that country, or probably is?
Well, we simply don't know, because we don't know. Officially there's only a few hundred cases in India. But, is there a few tens of thousands of cases that we don't know about? We simply don't know. The fact that the government is taking such draconian action means at least that the Indian government is worried about this possibility and is prepared to lock down the whole population for 21 days. And I really don't think they'll be doing that on a suspicion. I think they've probably got grounds for doing that.
Yeah. John, you say when we develop a vaccine, is it possible that we will not be able to find a vaccine for this? And it could take years or never?
That's a really frightening question, Brian. From everything I've heard so far, the vaccine developers do feel they are making progress. And because there's a lot of teams working on this, I don't know of any reason why they shouldn't be able to develop an effective vaccine. If you take something like HIV, where there's still no vaccine, that virus actually mutates quite a lot. The nature of the virus is always changing. And it looks so far that the COVID-19 virus is not changing as rapidly as something like the human immunodeficiency virus, for example. So I'm much more optimistic about producing an effective, hopefully one single vaccine for the whole world to the COVID-19. So, yeah, it's never done till it's done, of course. And we won't know till we actually get the result of the trials on the vaccine. But I'm optimistic that there will be a vaccine. I don't see any theoretical reason why there shouldn't be an effective vaccine for this. And I think it's fair to say that governments around the world now are highly motivated. And when governments are working together, they can achieve great things. We can put people on the move. We can get this. We can get a vaccine for this. I'm confident of that.
How do you get your head around how governments reply to this sometimes? Because these are politicians. They need to be elected. They obviously can't always tell the public everything, but they need to tell them the things they need to know. What do you see there when you see politicians talk?
There's no question, Brian. This is going to cause the fall and rise of world leaders. There's no question in my mind that world leaders are going to be judged on how they protected the lives of their citizens. That elections will be won and lost on what politicians are doing now to combat this infection. No question in my mind about that at all. As I've said, overall, I believe the reactions have been late. They've been reactive rather than proactive. I don't quite know why that is. I think basically it's this philosophical problem that because this has never happened, we can't imagine what it could possibly be like. It's almost a problem of the imagination, of conceptualization that's caused this problem. And also, of course, the economic consequences of the action that's been taken now are just immense. This is costing government. I mean, basically, my government is spending on a wartime footing or more at the moment, and you can understand why governments are reluctant to do that until the need for it is proved. And if people had taken my very conservative advice back in February and closed things down, then I would be getting shouted at for having closed down the economy for no reason, because the disease would not have come, because it would have been prevented and people would have never known this problem was there. But now people can conceptualize this idea of pandemic, that the spirit is moving and things are happening on a national and international level.
Well, that's the flip side, because your background is medicine, but if you do shut the economy down and then people have no money and they're also feeling cooped up, you can have social unrest, which then can lead to the opposite effect of what you're trying to do. So it is a balance, and the drop in economy can be devastating to people. Now, you can say lives are more important, but the devastation is real.
Well, that costs lives as well, of course.
It does.
Yeah.
Exactly. It does cost lives. Very well said, yeah.
Absolutely. I mean, I'm just glad I'm not a politician, Brian. I agree, it's been very, very difficult to politicians to make this decision. I still get the feeling that they've been about a week or two late all the way through it, though. The problem has been manifest, and they've reacted to it. The medical people were telling senior politicians this is going to be a problem. I must say that the reaction of the World Health Organization also seems to have been really quite reactive. I mean, all the brilliant minds in the World Health Organization, and yet they were saying carry on flying in and out of China. I was actually quite bemused by that in the early stages. So again, they've been reactive. But then again, the information they're giving out now and the logistical strategies they've implemented now are absolutely brilliant. They're now doing some really good work. So, people have come out of this looking really quite black and white. Some like the Chinese government started off really bad, ended up being really good. World Health Organization started off pretty ropey, then now is quite firm and giving out quite clear messages. Just pity quite a few people have come to the party late.
Yeah, I think it's because they're trying to weigh so many different factors on the back end, and not all of them can be quantified. Like, how do you measure panic? How do you measure compliance? How do you measure the damage to the economy, which is damage to more health? How do you estimate this? So you got people juggling that, and then someone comes out with a statement, based on all of that, and obviously there's human error and communication issues, and I guess we're seeing that across lots of cultures. Some with, like you said, in the East, a lot of experience and know what a pandemic can do, and then the ones in the West that maybe they saw the movie Contagion once, otherwise they can't conceive of it. And, let's be honest, humans can't conceive of a geometric progression of anything because we don't ever see it in our daily lives, do we?
It's a bit like a movie about an asteroid impact or something like that. It's just so much outside of people's experience that it's kind of in the fiction category, and they can't realise that it could actually become a reality. But having said that, I think politicians around the world now are starting to take the kind of action that we need. I mean, I think in the United States, there's been a bit of optimism just in the last couple of days, thinking that this is going to be over by Easter. It's not. But a lot of other senior leaders, especially at the state level in the United States, are starting to take the action that's required. European governments have been taking the action. My government's been a bit late, but France and Spain and Italy are taking the action that's necessary. Germany's just coming to the full realisation of the action it needs to take now. Smaller countries are coming to the realisation of what needs to be done. So I think the world politicians are now on side, and they realise that this whatever it is, this couple of months shutdown is really the only viable way forward at the moment.
I think when Donald Trump says something like by Easter everything will be back to normal, I think he gets a lot of criticism, but I also think he's looking at consumer confidence, which again is a very emotional behavior. And it still, I think it makes up 2/3 of the economy, how much consumers are willing to spend. And so if you can make people feel like, okay, maybe it's not as bad as it seems. Maybe, first of all, corporations won't lay off employees. Maybe people will spend a little more money as opposed to hold every penny. And then maybe in a way it might mitigate some of the damage. It's hard to say what's happening there, but there could be things we can't see right on the front because the doctors will stand up.
Completely. And I agree with them completely that this pandemic is going to resolve. We will get a vaccine. It will go away. The economy will bounce back big time. It's just a case of when it happens. And I think we have to maintain this sense of realism and to some extent a sense of optimism. Yeah. Pandemics have happened throughout human history, Brian. In my country, the Black Death, the bubonic plague first arrived here in 1348. It's happened before. There was the Great Plague of London in 1665. And of course, this famous American Spanish influenza in 1918, 1919. This has been, or if we think about smallpox arriving in the Americas, for example, more than decimating, killing probably 80, 90% of the indigenous population of South America, for example. And, this has been the lot in human history. So people will bounce back. Most people will get a mild illness with this. Most people are going to feel pretty ill for a few days, and then they're going to be okay. So 70 or 80% of people are going to recover from this. It's just the problem is that this 12% or 12, 14%, whatever it turns out to be, that gets serious illness, and the proportion that gets critical illness. That is the problem with this. And it may be, as we've already mentioned, that a lot of people get a disease that is so mild, they don't even know they've got it, which would greatly lower the case fatality rate. But we're not going to know that until we get the widespread antibody testing. So basically, we're kind of on hold at the moment.
Right. And then the problem is if the medical establishment gets inundated, then all your other normal procedures can't be taken care of.
I mentioned that today. It's called direct and indirect damage from this pandemic. So the direct effect is the people suffering from it. But I did mention today, in clinical work, I've had to go to people sometimes and say, well, your operation that was planned for tomorrow is now cancelled. I'm really sorry. And that's devastating. The anxiety, the emotional build-up, can't wait for tomorrow night when it's all over. And then you've got to say, no, sorry, it's going to be another few days now. And that's happening big scale now. Elective surgery, chemotherapy treatments are delayed. All these indirect effects that are devastating on every individual and every family concerned, because so much of the medical resources is devoted towards COVID at the moment. It's
and I mean and in the next 6 months, more people will be diagnosed with cancer, and more women will have to give birth, and life continues. And then now our our medical facilities are on hold. So,
Yeah.
it's potentially devastating. Just two final things I wanted to go back on. We didn't get to obesity. So just thoughts on obesity, and is that something people could control right now? Does it seem like it's going to be a real factor in this disease?
Yeah. Well, the only data I have on that I can actually relate to published literature is the British National, it's called ICNARC, the British Intensive Care Research Survey. And they monitored the first 196 patients. Now, I can't remember the precise figures, but no one was admitted to intensive care who were underweight. About 30% were normal weight, but about 70% were overweight or obese or morbidly obese. Now, a lot of people have said, well, so what? That reflects the general population. But in actual fact, I can't give you the precise figure on it, but the proportion of people that were overweight or obese that were admitted to intensive care, therefore had critical illness, was above the normal distribution of being overweight and obesity in the population. So it looks like that is being a factor to an extent. But there again, of course, if someone has obesity, they're more likely to have type 2 diabetes. They're more likely to have breathing problems. They're more likely to have cardiovascular disease. So I think what they've identified is a degree of correlation, not necessarily a degree of causality with the obesity one. So, but I certainly would advise everyone to optimize their health now as much as they can. So lose weight if you can. Eat nutritious food, have a good diet. I believe it's necessary to make sure you've got adequate amounts of vitamin D because we don't make vitamin D in English winters. If you smoke, absolutely stop smoking. There's benefit in that straight away. Your cilia will be working better within 24 hours if you stop smoking. And Dr. Tedros has advised people to moderate their alcohol consumption or even stop drinking as well. I don't know quite what his evidence for that is, but I guess it's just general exercise and well-being. We need to make sure we get plenty of exercise and we need to make sure we get plenty of sleep. And as far as we can, we want to reduce our psychological stress because all of these things help the immune system. Now, lots of people talk about immune boosting. We can't make the immune system better than it is because we have a good physiological immune system, but we can certainly make it worse than it is by having such things as malnutrition or lack of sleep. And I'm just glad you mentioned that the people giving birth there, Brian. I'm on record as predicting there's going to be a bit of a baby boom in December. I think the reasons for that are probably fairly obvious, with people being confined for long periods of time. But the thing that's really concerning there is if there is, as you suggested, a winter wave of a second wave of COVID over winter, especially if we have a bad flu season, then that means we're going to have the infective problems of potentially influenza and COVID-19, all the other usual winter things we get, all the other ongoing medical things that we get, and potentially a lot of people giving birth all at the same time. So I think there's probably a real factor to consider there as well.
That's really powerful. And John, the last thing I wanted to ask you was about surfaces. What do we know about how long this disease can last on surfaces? How should we protect ourselves? I know there's different surfaces. You mentioned the air conditioning, which was very interesting earlier. Yeah, tell us about these things.
The data on surfaces is limited. I only know of one study that's actually studied the SARS-1 and the SARS-2. It was published last week. And what that study showed was at about 20 degrees centigrade on stainless steel, the virus would remain transmissible up to about 3 days. Now, as soon as a droplet goes onto a surface, the number of viruses drops quite dramatically and quite quickly. But on stainless steel and plastic surfaces, it looks like at 20 degrees, normal humidity, 3 degrees is quite a reasonable estimate. Now, if it's colder, I would expect it to be longer. So at 5 degrees centigrade, I would expect the virus to survive much longer. At higher temperatures, say 30, 40 degrees centigrade in the tropics, 90s degree Fahrenheit, I would expect it to live for a lower amount of time, but we don't know that for sure. They said it would probably live for about 24 hours on cardboard and proportionately less on surfaces. But the other thing it can probably do is stick to human hair. So I think for men to be clean shaven for the time being is probably a good idea. Because if there's viruses in the air that get onto facial hair, then it's not far from the facial hair to the nose, the mouth, and the eyes. So that may have been one of the factors involved in spread in Iran, for example.
Wow, so men, shave your beards.
Why not?
And with paper and things like that, I mean, if you're being delivered food or being dropped off groceries, I mean, that's a real issue to consider, right?
I think cardboard is the figures. The figures show about 24 hours for cardboard. So I would expect paper to be similar to that. Now, if you're worried about it, you can leave it in the sun. Direct sunshine is going to kill the virus, the ultraviolet. Or, of course, you can just disinfect it with a wet wipe.
Okay.
These wet wipes, it'll say antiviral and antibacterial on it. So if it says antiviral on it, then yeah, that should be fine. It should kill the viruses and just clean them. Oh, the other thing we need to do is clean things where we can get the infection. Like that's my thermometer there. So if I use that and pass it to someone else, that can act as what we call a fomite. The infection can spread on surfaces as well. And of course, one of the things that's always in and out of dirty pockets and dirty hands is mobile phones. Especially if we're sharing them and you're breathing and coughing on your mobile phone. So I'm trying to remember and clean my mobile phone every time I wash my hands at the moment.
Okay.
And of course, that's quite frequently.
Yeah, I can imagine. A lot of us are thinking about our parents and our grandparents. These are people in their 70s and 80s. What's the reality, John? Are they going to have to be locked down for 9 months?
Well, the current guidelines is for the next 11 or 12 weeks. So the answer to that is it depends. For the next 11 or 12 weeks, the answer is definitely yes. That's clearly government instructions. It's basically mandated by the government that now. We don't have a choice in that. Now, whether that can be lifted depends on the level of community, how much virus is present in the community and how much community spread there is. What my big hope is, in 11 or 12 weeks' time, I'm hoping we have a massive testing facility. That means we can identify every infected person, isolate them, quarantine their contacts, and declare some people safe. In that case, when we've got the infected people neatly tucked away, like they did in South Korea and quarantined, then it would be safe to lift the guarding, as it's called, for more vulnerable groups. So my big hope is that there's less community spread in 11 or 12 weeks' time. We have extensive testing in 11 or 12 weeks' time, and we can liberate our parents again. My parents are both completely confined now. I don't go in the house anymore, just drop food off at the front door.
Wow. And how are their spirits?
Both well into their 80s, so both very high risk.
Okay. Are they maintaining spirits in that